When a medical director is not actually medically directing, things can really go off the rails. I did try to reach out to see if I could get an appointment with him. They didn't respond. Many of these spas are violating HIPAA. So what's illegal is that, hi everyone, I'm Dr. Kate D. And I would like to talk today about fake medical directors. What do I mean by that? I talked about that in my book, and I've referred to fake medical directors a lot, and I really want to clarify what that really means. This all started, this little investigation I did over the last 2 weeks, when someone I know, an industry insider, told me that she knew a medical director in California who was the medical director for 55 medical spas in California. Like, oh, you're kidding me. Like, that's not possible, right? 55 spas. She said, absolutely. There's somebody, I can't tell you their name. So I find it like I have one place. I supervise that place. I'm not always there. It does actually stress me out when I am not there. And I'm here in my office doing this research and recording these podcasts, but I am 5 minutes away from my spa. So if they did need me, I would be reachable. In addition, in the two spas at Glow, we have 3 doctors and 2 nurse practitioners and a PA, all of whom share responsibility for the practice. So there's always at least 2 medical providers who are prescribing, full prescribing authority in Washington State. So I know my places are covered. It's very, very important to me that we're available, that anything that needs to any input on or any kind of, God forbid, emergency, that there's always someone available to respond. So how could somebody managing 55 spas respond to an emergency or support all those providers? I just don't think that's possible. So my insider friend with the gossip didn't tell me who this was, but I thought, well, I might be able to figure this out with a little help from ChatGPT. So I figured out the right prompts to try to figure out who in California is overseeing, many, many spas. Now, I did not find anyone who is overseeing 55, although I'm sure that's possible. But I was able to find 2 doctors, each of whom is overseeing many, many spas. One of them is overseeing 14 spas, actually 13 in California, and believe it or not, 1 in Maine. And the other doctor is overseeing at least 12 medical spas. Now, let me tell you how I figured this out. Okay. Many medical spas, and they should, put the medical director on their website. So if you look at a website for a med spa, it should have the medical director on there. Now, many do not. Okay. So the ones that don't have a medical director, either they have one and they're just not on the website, or they don't actually have one. So anyway, moving on to our 2 doctors in California. The 14, let's take the first one. His name is Paul LeBand, and he is a board-certified internal medicine doctor in Napa Valley, and he is a palliative care doc, so he takes care of hospice patients, and that is, it's just an incredibly noble thing to do. He is a board-certified internist with 27 years of experience in primary and hospital-based care. He works for Calabria Care in Napa Valley. He's their full-time medical director for palliative care and hospice programs. He went to Tufts for medical school, which is an excellent medical school, and he completed his internship, residency, and chief residency in internal medicine at Maine Medical Center in Portland, Maine. He primarily lives in Napa, but I believe he lives part of the year, or at least has a place in Maine. So he actually, in addition to his palliative care job, I could find 14 medical spas that he's listed as a medical director for. And again, these are spas that have him on the website. Each one of these spas has the exact same picture and the exact same bio for him. And it says that he has a lifelong interest in aesthetics. And this list of spas extends all over California from Napa to LA. And about half of them are run by RNs, meaning it's a registered nurse who owns it and runs it. Now, interestingly, all of these websites list him as medical director, not owner. And many of them actually have nurse practitioners and PAs Both of those degrees allow you to do a good faith exam, meaning you're allowed to do the initial intake and assessment and then prescribe. But the ones where just an RN is present, they're not allowed to do those things. So, and then there's one med spa in Maine that has a naturopath, which I didn't even know was a thing in Maine, but apparently it is, and 2 PAs, and the owner of that one is a non-medical owner. So, in any event, it is my personal opinion. Now, this guy's not doing anything illegal that I could find himself. My personal opinion, you can't be a medical director if you're never there at all. And he can't possibly respond to, urgent needs or emergencies. But most importantly, I would guess that he doesn't work at any of these spas. He could potentially, but it's not even physically possible to be in all those places at the same time. Now, the going rate for a medical director to rent their license if they don't do anything is about $500 a month. And so if he's truly not doing anything, he's probably making about $7,000 a year from these 14 spas. Could be more than that. $500 a month is pretty low, but that's the going rate if you're not doing anything. Now, if you're actually showing up and working, you probably are making a lot more than that. But my guess is he's got a full-time job in Napa, and he is not going around to all these places and the one in Maine all the time. But I don't know that. I don't really know his involvement. It's not really possible to find. I looked at every single website. None of them offers an appointment with him. I did try to reach out to a couple of them to see if I could get an appointment with him. They didn't respond. I also tried to reach out to him through his hospice job, and there was a response actually from an RN who runs operations there, but I didn't get to actually speak with him. Now, interestingly, the reviews for these spas are generally quite good. There's only one pretty bad review from about a year ago from one of them. And they do mention him by name. That's, of course, how I found him. And it basically says they accuse him of not caring and not being responsive and not being there, which is probably true. I don't really know. So again, what's illegal about this? Okay, it's illegal for the RNs to be providing care unsupervised. And it's illegal if any of those places are offering services without a good faith exam, which is probably happening in those ones where there's only an RN. Now, there's a second doctor that is very, very similar, but this second doctor actually does aesthetics, and he has his own practice where he does aesthetics. His name is James Kojian, or Jim Kojian. Actually, in some areas, it refers to him as Humpart Zoom, but he goes by James Kojian. His bio says that he went to the University of Illinois Medical School and then trained in emergency medicine at White Memorial Medical Center in Los Angeles, California. His bio also claims that he's a board-certified physician and surgeon and certified anti-aging and longevity specialist. I did look him up in the ABMS, and he is not, there's no one by that last name who is board certified except for a different guy with that same last name. His first name is different, who is board certified in OBGYN in Orange, California. In the entire country of the United States, there's no other board certified physician with that last name. So I don't know how he's claiming that, or if he could have been board certified in the past and he lost that, maybe he didn't keep that up. It's possible. But currently, there's no evidence that someone by that name has a board certification. His bio also says that he has training in aesthetics through the oculoplastics department at UCLA, many years experience in aesthetic medicine, and additional training through the American Academy of Anti-Aging Medicine. And those things are ones that like any doctor can do those courses, and that's great. And he has actually great reviews. I did not find any legitimate concerning negative review about him. He is supervising 11 med spas that I can find. Again, there may very well be spas that he's the medical director of that I couldn't find, but there are 11 that list him as the medical director. But interestingly for him, every single one of those 11 spas list him as an owner and a medical director, which I find very, very interesting because if he were the owner of the whole spa, then that would be quite an investment. And I would think that he would be much more personally involved and engaged in each one of these spas. But anyway, most of these are around the LA area. His practice is in Pasadena, and some of them are RN only, but many of them have nurse practitioners and PAs. And so it's a very similar situation to the other guy in Northern California. Although it's if he's only the medical director for 11 spas, then that's about at least $5,500 a month for Dr. Kojian for being the medical director. So overall, I looked at reviews for every single one of the spas I'm talking about. Overall, they are excellent. So it's not like the providers in these spas are doing anything to harm people that we can tell from reviews. There's only that one bad review, and it's very hard to know from one bad review whether there's really an issue. Typically, when you see many bad reviews for a spa, then that is more of a red flag. There was one that Dr. Kojian was associated with called Fremont Laser Spa in Fremont, California. That domain is insecure, and I couldn't look at their website. But from everything I can tell, the last review that is available online for that spa, they were terrible reviews, terrible. But the most recent one is from 3 years ago, and I think that spot is likely shut down now. So, but the rest of all of these places have excellent reviews. Interestingly, the only violation I could really tell from sleuthing on the web is that many of these spas are responding directly to reviews, good and bad. And in many of them, they're violating HIPAA by acknowledging that that patient came to that spa, had that service, addressing their complaints or their compliments directly. And that is actually a violation of HIPAA. It's a privacy law that governs everything that doctors do and communicate about medical information. And you cannot publicly respond to a review with anything but generic information. So for instance, if you said something like, oh, I went to Dr. D and she just did the most fantastic job on my Botox. I love it. I'm totally going back. If I responded like, thank you so much. It was so great meeting you and your mom. I'm looking forward to seeing you in 3 months. Okay, that's not legal. Okay, because I can't actually acknowledge like, yep, I saw you for Botox. I can't do that. And the same thing for a negative review. I cannot directly respond to a negative review. But what I can do is respond and say, thank you so much for your kind words. We pride ourselves in our excellent service, blah, blah, blah. Or, I'm so sorry to hear about your bad experience. We pride ourselves in our excellent service. And this is our policy about cleanliness and safety, or whatever it is. You can respond with generic policy responses, but you can't acknowledge anything specific about the patient's care. So I have found when you look at reviews for medical spas, you will see a lot of direct responses, especially of the negative ones. People say, well, there was one that was like, well, you brought your nasty dog that barks at everybody and blah, blah, blah. It's like, you just can't do that. So why do I care about these absentee medical directors? And I'm calling them fake medical directors. They're not fake. They're real doctors. They're real people. They got to, send their kids to college just like I do. But I just don't think it's ethical. So let's look at the law in California as it pertains to medical directors. There's a fantastic summary from January of 25 about exactly what kind of oversight is supposed to happen in a medical spa in California. This is really, really helpful. It's by David Holt, and it talks about what kind of supervision. And basically, the answer is there is no mileage requirement or distance, or time to drive in requirement. It is left to the doctor's judgment what adequate supervision is. Okay. Now, there are very specific things about RNs because RNs cannot practice on their own. They can only carry out a doctor's orders. So there are some specific provisions in there. But there's nothing that says you have to be 20 miles away or within 100 miles or even more than that. There's nothing specific. It's just reasonable judgment that they're asking for. It is my opinion, right, that if you're on the opposite end of the country or the opposite end of the state, you can't really be supervising somebody like that. Now, we can do a lot of things remotely now, and that's totally fine. And I think that it's very possible to manage somebody remotely, to be available for questions and stuff, but someone has to be available in case of emergencies. And that's just really not physically possible when you live at the opposite end of the state. So what are the other things that kind of bother me about this? Because if it's legal, it's legal. Why am I complaining about it? Well, the big thing is, when a medical director is not actually medically directing, then things can really go off the rails. So what's illegal is that if you perform a service without a good faith exam, that's illegal. If there is no good faith exam, that's illegal. If an RN is prescribing a treatment, that's illegal. And what happens with these absentee medical directors is that all of those things happen. It doesn't happen at every place, but that is how the slippery slope happens. And so I just think that it really, so certainly the law would have something to say if somebody were harmed. Okay. So the other thing that I can't confirm is corporate ownership, because I've tried in California. When you look up the California Secretary of State and the listings of businesses, it lists an agent that filed, but you can't really see who the owner is and you can't see what their corporate structure is. So as we've discussed on this podcast, nurses and PAs can't own a medical practice. If they want to have an MSO set up that legal structure, then they can own the business part of it, but then the doctor needs to own the medical practice. And when you have an absentee medical director, very often there is illegal corporate ownership of a medical practice. Not all the time. It is very possible that you can hire a lawyer and set up all of your agreements in such a way that it would not be legal. It's just impossible for me to verify. I do think it's very interesting that the second doctor, Dr. Kojian, is listed as owner on all the websites. I think that is a way to get people to believe that the corporate ownership is legal. And he might very well be. It is very possible. That would be an amazing feat if he really is, 51% owner of 11 medical spas, not including his own. So that'd be pretty amazing. And I'm not complaining about a savvy business strategy here. I am just pointing out that I would not want to go receive care from someone who is not being supervised. So I think that's a really important issue. And then the last thing is what I would wonder about is, do these med spas have proper malpractice insurance? Most malpractice has something to say about the medical director and what they're doing there. And typically, if you have, me, like I have my own place, I have my own medical malpractice. If I were also the medical director for another spa where I don't go, then their malpractice should cover me as a medical director. I would want to make sure that every one of those spas was set up in a way that they actually had valid malpractice insurance. The reason I'm suspicious is that most malpractice would not cover you or wouldn't want to cover you if they knew that you lived on the other end of the country or in another part of the state, many hundreds of miles away. Malpractice insurance claims are expensive for them, and they are not willing to take a risk on people who are not actually being kosher. So I don't know. There's no way for me to know whether these places have malpractice insurance, but I think having an absentee or fake medical director is a setup for not having all of the proper legal structure, good faith exam, supervision, and malpractice insurance. So I'm really excited to tell you that the MedSpa board is launched and live. And over the last 2 days, I've actually had my first 3 applications. I'm very excited. I'm going through the process of approving those, investigating those to make sure that they're all on the up and up. If anybody is interested in applying, our system's open and live. It's fantastic. If your place is fantastic and you love it, ask them to get certified. And if they have questions, they can reach out to me directly. I wanted to give you this overall about, fake or absentee medical directors, because I think it's really important. If I can find out who the guy is, or woman possibly, who is the medical director for 55 spas in California, you can guarantee I will be back with more information on that guy. Thanks for listening. If you found this helpful, do me a favor and share it with a friend who's considering any aesthetic treatments. Subscribe so you don't miss the next one, and drop a comment telling me your biggest takeaway. I actually read them all. Let's keep each other safe and elevate the standards in the med spa industry.